Previously,
that I'd come back and let you know how I became a doctor in 3 years. So I ended up graduating from biomedical science, which still had to graduate with a first and 2 prizes. So I got transferred onto medicine. So what I got transferred onto is T year, which is known as the transition year. So if you are doing medicine from an undergraduate position, so if you had entered straight away, this would have been your 3rd year of medicine. Whereas if you were a graduate, so you had already done a different degree and you were doing a postgraduate medicine course, this would be the 2nd year. So we all came together in what is known as the transition year. A few weeks before the transition year, we had a 2-week period, so for all 20 of us who got this transfer position, in which we had to learn 3 years worth of medicine, personal development, clinical skills, taking blood in a 2-week period. So for all the medics, imagine doing cranial nerve exam, upper limb neuro, lower limb neuro, all in the space of like 3 hours, and it's just so crazy. You're hearing terms you've never heard before: dysdiadokinesia, you're learning about cerebellar rebound, you're learning about acuity, you're just learning about so many different terms that you've never heard about, and that's crammed all into a 2-week period. You're given a book, so basically go home, read it, you need to catch up. And then 2 weeks later, we finally joined all the medics in what was our transitional year or 3rd year. So in that year, we had 5 weeks of placement and then 5 weeks of like teaching, is known as your PBL block, problem-based learning block. 5 weeks of teaching. Of course, for the 20 of us who were transfer students, we were in block A, which meant that we started off with teaching before going on the wards. So in that, you'd have a case every week. So it'd be like a 40-year-old man presents with, shortness of breath and chest pain. So, and then you're basically working through the case. So you have this with a group of about 5 or 6 people on a Monday and then a Friday. So on a Monday, you then set learning objectives. So differential diagnoses, which are the different things that could be causing this man to have shortness of breath and chest pain. Could it be the heart? Could it be the lungs? Could it be muscular? And then throughout the weeks, you have lectures around it. So you have lectures about heart attacks, you have lectures about clots in the lungs, you have lectures about an infection and some of the muscles around, your chest area, you know what, I'm not even going to mention it, costochondritis. Don't see it. Costochondritis. Sorry. And then on the Friday, you go through what you found out and then you solve the rest of the case and then you start a new case. So that happened, ended up having exams. So we had a mock exam during the January period. So let's say we started in August. During January, so for the 20 transfers, we had a mock exam, which is a mock of our clinical skills. They obviously wanted to see if we were competent enough, if we needed any additional help. So it was 5 different stations, just practicing taking a history from a patient or examining the patients, just to see if whatever they taught us in that 2-week period we had picked up, or if we had done any additional learning. And then when it hit May, we actually had our medical school exams. I was so scared. I had never done medical school exams, and I felt like we were just literally thrown into the deep end. But honestly, because I was so scared, I spent that whole year banging out revision, making so many medics friends, just asking them, how do I do this, how do I do that? And literally, I feel like whenever I'm faced with like adversity or put in the deep end, that's when I just rise and I just soar. And honestly, thank God, I ended up doing really good in that year. And then we moved on to P year, which is penultimate year, so the year before final year. Bearing in mind, I just told you we had just started medicine the year before and we were already in the penultimate year. That year was basically all placement. So before that placement block, you'd have a week of teaching, and this is where I had just learned about asthma the year before, but now I was going to learn about placenta previa, I was going to learn about multiple sclerosis, I was going to learn about all these like niche, you know, topics. It's when we had all our specialties, so doing stuff like pediatrics, doing stuff like obs and gynae, doing stuff like neuro, how can I forget psychiatry? Doing things like surgical specialties like trauma and orthopedics, ophthalmology. Bearing in mind, I had just started medicine the year before. Even though, yes, I did have that foundation training with the doctors, but I literally had to relearn things that people in my cohort had known from first year. So P year is such a super long year. It's literally like 11 months. Barely any breaks, as well as studying and having like almost 1,000 learning objectives or conditions to get through. You're always at placement, and at placement you had things known as DOPS to do. So someone had to observe you taking blood, someone had to observe you, you know, doing so many different procedures, sometimes diagnosing death, putting in a nasogastric tube, just so many things. We had to, you know, clerk patients, to take a history from patients, and then speak to doctors about it, or they watch us examine. And it was literally such a draining year. I'm so happy I never have to do P year again, because your girl lost her damn mind, honestly. So P year passed, had 2 OSCEs, which are the exams I said when you're observed. Basically, there's an examiner in the room and there's a patient in the room. You you show them what you do if you're faced with a certain scenario. So if someone's homeless and, you know, they need a medication but they don't have a fixed address or abode, examining patients. We actually had kids in our OSCEs, just so many different scenarios, and then passed P year really well. So bearing in mind that I had entered medicine and I was already with a cohort of different people, I was always like in the top 20% or top 10%, so I was doing really well. Once again, using the study method I talked about, you know, making friends, just finding so many different friends, talking to different people, using so many different resources. Like, I thank God I became friends with Reem, who was already a medic. She literally was my savior, just giving me so much guidance, just so much motivation to get through P year. And then within a month, your girl was in final year. But I had just started medicine 2 years before, and you're telling me I was going to be a doctor. So the journey I had already done was a lot more than the journey I had left. Deep that. So I literally entered final year, which zooms by, and your girl was breaking it. I went from being an A girl, always doing pretty little thing, hauls, shopping, to become almost being a doctor in like 6 months. Honey, final year was crazy. Literally, we had to send off applications for hospitals we wanted to work at, which was so surreal. I remember recording a video in my cornrows like, I'm going to be a doctor. Like, I'm applying for hospitals. Like, a few years ago, I was going to be in Warwick doing psychology, but look at how my life transformed. Honestly, like, if something is destined for you, it will come to you, and the way it comes will surpass all understanding. But here I was. Final year was just, I literally had to keep pinching myself, because I was just like, wow, I am near the end. So we had a few national examinations, so the SJT, situational judgment test. When I make a video about final year, my experiences, I'll go into that more. We had our prescribing exam, which was happening like pre-lockdown times, and then we literally went into lockdown, and it was so crazy. Becoming a doctor and doing your finals during lockdown was literally the most anxiety-provoking time of my life. When I wasn't glued to my books, I was glued to my emails. My uni were like seemed to be the last to respond. So many universities, so Imperial, Cambridge, had cancelled certain exams. So we used to have the OSCEs, which would involve us dealing with real actors, but obviously that's a risk for getting coronavirus. So we were just like, how are we going to deal with this? We obviously had written exams. Like, it was just such an uncertain time. And then they finally cancelled ASCIIs, which is the exam that's quite a few people fail on. And we just had written exams, but they were going to be online from the comfort of your own home. And even that whole experience, I'll get into it later on, but then did my exam. It was a 3-hour exam in, you know, silk gown, as you heard first on ITV News. Let me know in the comments below if you've watched my interview. Banana by my side, water. I was clutching. I mean, my laptop did turn off halfway through the exam, but the devil was really trying me. But the girl made it through and became a doctor babe. Who is making noise? I'm joking. So yeah, that's the story on how I became a doctor in 3 years. Journey for so many people is different. Some people go in straight away, some people go through the journey I did. So my uni is very overt with in the sense that they do the transfer. Some universities do a secret transfer, so read into it. I'll try and provide information down below of universities that do it, or even if you have a degree and you come through the postgraduate route. There's so many ways to become a doctor. If you haven't made it in the first run, like, delay is honestly not denial. If this is for you, it will surely come to you. So thank you so much for watching this video. If you made it to the end, you is a real MVP.